Posturography can be asked a short note under recent advance, and also in clinical practice it is important. So what is posturography? What are the principles, types of posturography, the parameters measured, clinical applications and advantages of posturography. So what is posturography? From the word itself literally means description of posture. That is any means of recording postural activity, the position of various body parts during quiet stance or while being seated, or in active and passive regulations of balance. So posturography is a medical assessment quantitative tool that evaluates patient's ability to maintain balance and postural stability. It is direct and an objective test that is useful in monitoring and also in aiding in the rehabilitation of individual balance. Coming to the principles of posturography, this primarily measures the sway of body's center of pressure, which is called COP, or the center of gravity, while an individual stands on a force plate. So naturally, what is a force plate? Force plate, as you can see here, it's an instrumented platform containing transducers that measures the ground reaction forces and the moments exerted by the feet. And these measurements are then used to calculate the COP, which is a point of application of the resultant ground reaction force. You can understand the posturography by seeing how it is being done. And the patient is permitted to stand on a force plate, and it is stabilized with hooks in order to avoid fall. And then the patient sway in static position and also balancing capacity in the standing position, and with eyes open, eyes closed, and also with the eyes open with surroundings moving. All these are tested, and from the force plate the transducers will measure this and it is recorded on a screen. So the fundamental principle is that increased postural sway indicate reduced postural stability. By manipulating sensory input and support surface conditions, posturography can isolate and assess the relative contributions of the visual, vestibular and somatosensory system to balance control. You can see in this, you can see the while the patient is swaying, the force plate also sways with that. And from there the center of pressure or the center of gravity is recorded. So the fundamental principle of posturography is that increased postural sway indicate a reduced postural stability. By manipulating the sensory input and the support surface conditions, this can isolate and assess the relative contributions of the visual, vestibular and somatosensory system to balance control. So there are two types of posturography. One is static and another one is dynamic. Static posturography is otherwise called stabiliometry because the patient is standing stable. This assesses the spontaneous postural sway while the patient stands as still as possible on a fixed force plate. Patient stands barefoot on a force plate, usually for a period of 30 to 120 seconds per trial, and the conditions are eyes open, then eyes closed on a firm surface with a normal somatosensory input, and also on a firm surface, that is the compliant surface that reduces reliable somatosensory input from the feet, angle and stressing visual and vestibular system. And the measurements are primarily quantifies the magnitude and velocity of COP displacements. And the second type is a dynamic posturography or a computerized dynamic posturography or CDP. This employs a sophisticated system that can manipulate both visual environment and the support surface in a controlled manner. This allows for a more detailed analysis of how the individual utilize and adapt to different sensory conditions, and also the individuals respond to external perturbations. An example of this is a neurocom equitest system. This is a widely recognized example, and there are different components of CDP like sensory organization test, motor control test, adaptation test, etc. The parameters measured in posturography are: one is sway area, another one is sway velocity, then the sway amplitude, frequency analysis, that is decomposing COP signals into different frequency components can reveal specific patterns associated with a different underlying pathology. For example, low frequency sway often associated with a central pathology and high frequency sway associated with a peripheral neuropathy. Then equilibrium score is another one. Then sensory analysis ratios, latency. The time latency is the time elapsed between the onset of platform perturbations and initiation of a corrective postural response like muscle activation. Increased latency suggests an impaired motor response. Then amplitude scaling. The clinical applications are: posturography serves as an invaluable diagnostic as well as monitoring tool across various medical specialties. One, vestibular disorders. This helps in the differentiate between peripheral vestibular dysfunction as in Meniere's disease or vestibular neuritis, and also in central vestibular disorders. Identification between, differentiating between peripheral and central vestibular disorders. Then monitoring also tracks recovery and post-vestibular rehabilitation or medical treatment. Then in neurological disorders like Parkinson's disease, multiple sclerosis, cerebellar ataxia, then peripheral neuropathy, and also in some orthopedic conditions like ankle sprains and ligamentous injuries, it evaluates proprioceptive deficit and guides rehabilitation. Then in knee osteoarthritis, this can assess balance impairment and fall risk. Post-surgical assessment to monitor recovery of balance after joint replacement surgery. Then fall risk assessment in the elderly, and also prediction, that is identifies individuals at high risk of fall and allowing for targeted interventions. And this also establishes a baseline for balanced performances. Then concussion assessment, and it provides an objective data on balance deficit post concussion, aiding in return to play decisions. And there are forensic applications also, like in intoxication, can objectively measure the balance impairment due to alcohol or drug intoxications. And there are some advantages of posturography, like standardized and reproducible postural perturbations, then quantitative and objective outcome measure. Then it also allows simultaneous recording of multiple variables, and also there is ability to selectively manipulate elements of postural control. So this is regarding posturography.